Okay, so we're diving into this unified health ecosystem thing you sent over. Looks like you're really interested in how all kinds of businesses are, like trying to find ways to make money as healthcare changes. And this document's got a lot to unpack there.
Yeah, what's interesting here is how it really pushes the boundaries of how we think about healthcare.
Right.
Like we're moving away from just hospitals and insurance companies calling the shots. It's becoming more about, all these different businesses working together, kind of like
A big healthcare mashup.
exactly. And that opens up a ton of opportunities.
Right. So, like, why is everyone suddenly trying to get in on this?
Well, for starters, healthcare is huge. We're talking trillions of dollars globally, and it's only getting bigger. But it's more than just the size, right? It's like this perfect storm of changing consumer demands, crazy fast technology.
Oh.
It's a recipe for disruption.
So it's not just about getting a bigger piece of the pie. It's about baking entirely new pies, right?
Exactly. And those new pies, they're pretty tempting.
Okay, but what's changed with consumers? Are people suddenly, like, obsessed with kale smoothies and marathon running?
Not exactly. It's more about wanting healthcare that fits into their lives, convenient, personalized, uses all the latest tech. Think about telehealth during the pandemic.
Right. Everyone and their grandma was suddenly having appointments online.
That's just a taste of what's to come. This document, it basically says the digital health market is about to explode.
A digital health gold rush. I like the sound of that.
Yeah, but there's a catch. Just because you have an app doesn't mean you'll strike gold. This isn't some Silicon Valley free-for-all. Healthcare has rules, ethics. It's a lot more complicated.
So how does a company even begin to figure out where they fit in all of this? You mentioned this whole leveraging your strength thing.
Right, so like imagine you're a big tech company.
Okay, I've got Google in the mind.
They've got tons of data, right? And they're really good at artificial intelligence. This document talks about how they could use AI to build these amazing diagnostic tools.
Mm.
Instead of recommending products, their algorithms could be analyzing, let's say, medical images to find diseases super early, maybe even saving lives.
Wow, so they're like disease detectives now. That's amazing.
Ah,
What about companies that aren't, tech giants? Can you give me an example of a different industry diving into the mix?
totally. Think about like retailers.
Retailers like
Yeah.
Walmart and Target.
Yeah, they've already got stores everywhere, super convenient locations. This document points to companies like CVS and Walgreens. They're putting clinics right inside their stores so people can like grab their groceries and get their blood pressure checked all in one go.
That's so smart, making healthcare part of your everyday routine. What other kinds of companies are well positioned to win in this unified health ecosystem?
Telecom companies are another interesting one. They're the kings of connectivity, right?
Yeah.
And that's crucial for the whole Internet of Things thing, especially for health.
Right, all those smart watches tracking your every move, every heartbeat.
Exactly. Telecom companies are basically building the roads for all that data to travel on. It's all connected.
Okay, this is all fascinating, but let's be real. Businesses aren't just doing this out of the goodness of their hearts, right? There's got to be a solid financial incentive. What's the bottom line here?
And then this is where the document really gets into the nitty-gritty, which makes sense given your interest in the financial side. It goes beyond just saying, oh, healthcare is a big market. It breaks down why this whole diversification thing can be incredibly lucrative.
All right, I'm all ears. Break it down for me.
So one of the big things it talks about is the potential for completely new revenue. Not just taking a bigger slice of the existing pie, but like inventing entirely new pies. Think about things like subscription-based telehealth services or digital health platforms with recurring fees. It creates a level of predictability that a lot of companies find really appealing.
So instead of one-off transactions, you're building these ongoing relationships with customers, getting that nice, steady stream of revenue coming in.
Exactly. And another thing it emphasizes is how companies can optimize what they're already doing. Take those retailers again. They've got all this space, right? So instead of building something entirely new, they just integrate healthcare into their existing operations. Less overhead,
Hmm.
leaner business model, potentially way more profitable.
It's like the ultimate two-for-one deal.
Right. And we haven't even touched on the financial benefits of like brand diversification. Getting into healthcare can make a company more appealing to investors. It's less risky.
Okay, so far so good. But there have to be some downsides.
Of course, it's not all sunshine and rainbows. The document doesn't shy away from the risks. It actually spends a lot of time outlining what could go wrong.
Like what?
Well, first off, getting into healthcare can be really expensive. New tech, infrastructure, navigating all the regulations. It's not for the faint of heart,
So you need to have deep pockets to even play the game.
pretty much. And even then, there's no guarantee of success. The healthcare industry is constantly changing. New regulations pop up. New tech disrupts everything. You got to be ready to adapt.
So how do companies navigate all that? How do they even know if it's worth the risk?
That's where this document gets really interesting. It stresses this idea of really thorough due diligence,
Mm.
like really doing your homework before you jump in.
Okay, what kind of homework are we talking about?
Everything. Researching the market inside and out, understanding your competition, figuring out all the legal and ethical stuff. It's about approaching this like any other big business decision. You don't just throw money at it and hope for the best.
It's about having a solid plan, understanding the risks, and being ready to adapt. So knowledge is power, right?
Absolutely. And that brings us to another key takeaway from this document: how to build a compelling business case for this kind of expansion. It's not enough to just say, hey, healthcare is hot right now. Let's get in on the action.
Right. You need to do more than just follow the hype.
Exactly. The document lays out a pretty clear framework, and it all starts with pinpointing a specific need or opportunity that, really aligns with what your company's good at.
So it's about finding that sweet spot where your expertise overlaps with a real problem in healthcare that you can actually solve.
You got it. And then you need to back it all up with data: market size, growth potential, competitor analysis. You have to build a rock-solid argument that this diversification makes financial sense.
So you treat it like any other major business investment, analyze the risks, model the financials, and make sure there's a clear path to actually making money.
Precisely. And here's the thing. This document doesn't just focus on the numbers. It also dives into the ethical dimension of operating in healthcare, which is something a lot of companies overlook.
Right, because with healthcare, you're dealing with people's lives, their well-being. It's not just about the bottom line.
Exactly. This document really drives that home, which I think is one of its strengths.
So it's about finding that balance between doing well and doing good.
Exactly. Now, shifting gears a bit here, let's talk about the operational side of this whole diversification thing. This is where it gets really interesting, especially when you start factoring in the cost of new technologies.
Yeah, and technology can get pricey. This document digs into different ways companies are trying to balance that cost with actually making a profit, making the numbers work.
Right, because a fancy new app doesn't pay for itself. So what are some of the financial models this document talks about?
Well, one that's getting pretty popular, especially for digital health stuff, is the whole subscription thing. But it's not as simple as just copying Netflix.
Okay,
Right?
so it's more nuanced than that.
Yeah, way more. They'll have all these different tiers with different features and stuff so they can appeal to different types of customers.
So, like, a basic tier might give you teleconsultations and some basic health tracking, but then a premium tier could include, like, personalized coaching, genetic testing, maybe even direct access to specialists, all for a monthly fee. Exactly. And companies love this model because those recurring fees, they create this nice, predictable revenue stream that you've used that to keep developing new stuff, stay ahead of the game. But this document's not afraid to point out the downsides either.
Which are?
Well, you always have the risk of people canceling their subscriptions, right?
Mm.
And companies are constantly under pressure to keep innovating, adding new features. Otherwise, people get bored and go somewhere else.
It's like you're running a marathon just to stay in the same place. What about services that don't really work on a subscription basis?
Right. And that's where this other model comes in. Pay-per-use. Think like specialized diagnostic tests, virtual specialist appointments, those sorts of things. Customers pay only when they need them.
So it's more flexible for everyone involved. But I imagine it must be a nightmare to manage all these different models and figure out the right pricing strategies.
Oh, for sure. It's super complex.
Mm-hmm.
This document actually talks about how a lot of companies are moving towards what they call like hybrid models. So they might have a basic subscription, but then you can add on extra services as needed, kind of the best of both worlds.
Right, gives the customer more control, and the company has a more stable base to build from. Okay, this document seems to be big on flexibility and adapting to different situations.
Totally. And that brings us to another revenue model that's getting a lot of attention, but it's also a bit controversial: data monetization.
Ah, yes, data monetization, the billion-dollar buzzword. That also kind of makes my skin crawl a little when we're talking about people's health information. That's just pretty personal.
You're not wrong to be cautious. This document, it really emphasizes the ethical stuff here. It says that any data strategy in healthcare has to prioritize patient privacy above all else. No exceptions.
So we're not talking about selling individual patient data to whoever's got the deepest pockets.
Definitely not. This document talks a lot about anonymization and aggregation, which basically means, okay, imagine a company's collected data from tons of patients with a specific condition, right? Instead of selling individual records, they strip out all the identifying info and just look at the overall trends and patterns.
So they're selling insights based on like a big anonymous pool of data.
Exactly. And that kind of data, it's super valuable for things like medical research, building new drugs, even public health initiatives.
So it's more about advancing the field as a whole, not just someone's bottom line.
Exactly. And this is key. Transparency is essential. The document really hammers that home. Patients need to know how their data is being used, and they need to be able to say no if they're not comfortable.
So give patients control over their information.
Got it. Okay, we've talked about a lot of different financial strategies, but I want to shift gears a bit here and talk about mergers and acquisitions. Big companies gobbling each other up. It's like a corporate jungle out there. So what makes M&A so appealing in the healthcare space? Well, for one thing, it's a quick way to grow and dominate a market, especially in a fast-paced industry like healthcare. Like, let's say you're a tech company that wants to get into telehealth, right? But you don't have time to build everything from scratch. It's much easier to just buy a company that's already doing it well.
Cut out all that messy startup stuff.
Exactly.
Yeah.
But of course, it's not that simple. The document makes it very clear that due diligence is crucial here. You really need to know what you're getting into before you sign on the dotted line.
So it's not just about looking at a company's bank account. What else are we talking about here?
It's about evaluating everything. Their tech, their compliance with all the healthcare rules, even their company culture. You want to make sure it's a good fit.
It's like a marriage, not just a business deal.
Right. Got to make sure you're compatible. And speaking of compatibility, the document also points out that M&A can be a way to save money through economies of scale.
Ah, yes. Because bigger is always better.
Well, not always. But sometimes merging operations can make things more efficient and less expensive. Like, imagine a huge pharmaceutical company buys a smaller biotech firm.
Okay, I'm picturing it.
The big company gets access to all the smaller companies' research and development, and boom, they can bring new drugs to market way faster.
It's all about synergy. But all this talk about giant corporations swallowing each other up, what about the little guys, the startups out there trying to make a name for themselves? How do they compete in this kind of environment?
That's where strategic partnerships come in. This document, it actually dedicates a whole section to how powerful these partnerships can be, especially for startups.
Okay, so tell me more about these strategic partnerships. What makes them so valuable?
It's about playing to your strengths and finding someone who complements your weaknesses. Think about it like, say you've got this amazing new medical device, really groundbreaking, but you're just a small startup, right?
Mm-hmm.
You don't have the resources to get that device into hospitals and clinics all over the country.
You need someone to help you get the word out.
Right. But if you partner with, like, a big medical device manufacturer.
They already have those connections.
Exactly. They've got the distribution channels, the relationships, the whole 9 yards. And it's not just about distribution either. Startups can partner with research institutions to do clinical trials, tech companies to improve their products. Even insurance companies can be valuable partners.
It's all about finding those win-win scenarios. But we'd be remiss if we didn't talk about the risks involved in all of this.
Absolutely. We've touched on some of the financial risks, but this document, it goes deep on this.
Lay it on me. What are the biggest threats companies need to watch out for?
Well, the regulatory landscape in healthcare is notoriously tricky. It's always changing. What's allowed today could be banned tomorrow, so companies really need to stay on top of that.
That sounds stressful.
It can be. And then there's the whole cybersecurity thing. As healthcare becomes more digital, data breaches are a huge risk. We're talking about people's most sensitive information here, so security is paramount.
So how do companies protect themselves? Give me some reassurance here.
Well, the document emphasizes proactive risk management, strong cybersecurity measures, good insurance, and a deep understanding of all the rules and regulations. You can't just wing it in healthcare.
It's about being prepared, not just profitable.
Exactly. And all of this ties back to the ethical side of things, too. Companies that cut corners or prioritize money over ethics, they're not just putting themselves at risk, they're putting the whole healthcare system at risk.
It's about building a system that people can trust.
Mhm.
Okay, we've covered a lot of ground here, but we've mainly focused on what's happening now. What about the future? what trends are on the horizon. So we're gazing into our crystal ball here. What's the future of healthcare look like?
Well, one thing that has a lot of people really excited is personalized medicine. But we're not just talking about like tweaking your treatment plan a little. It's way bigger than that.
Okay, so what are we talking about?
Think about all the advancements in genetics, data analysis, AI. We're using all of that to develop treatments tailored to your specific genes, your lifestyle, even your environment. It's like healthcare with a personal touch.
So instead of getting a one-size-fits-all treatment, you're getting something designed specifically for you.
Exactly. And that could completely change how we approach healthcare. Better outcomes, fewer side effects. We could even start preventing diseases before they even show up.
That's amazing. So it's like predicting the future of your own health.
Kind of. This document highlights a bunch of different opportunities here, like developing personalized diagnostics to find people who are at risk for certain conditions, or creating super targeted therapies that are way more effective. We're even seeing personalized nutrition and lifestyle recommendations based on your genes and all that.
It's like, finally, healthcare is catching up with everything else, you know? Like, we're used to getting personalized recommendations for everything from movies to clothes, and now we can add healthcare to the list.
Exactly. And speaking of personalization, you can't talk about the future of healthcare without talking about artificial intelligence.
Right, AI, it's everywhere these days. But is it really all it's cracked up to be, especially when it comes to something as important as healthcare?
Oh, it's more than just hype. We're already using AI in healthcare, like right now. It's helping doctors analyze medical images more accurately, helping researchers discover new drugs.
So AI is like this super smart assistant that can analyze huge amounts of data and see patterns that humans might miss.
Exactly. And it can free up doctors and nurses from doing a lot of the administrative stuff that takes up so much of their time.
So no more robot doctors replacing humans.
Not quite. It's more about helping human healthcare workers be even better at their jobs.
Got it. Okay, so we've got personalized medicine, AI. What else is shaking things up in the healthcare world?
Well, we touched on this earlier, but the Internet of Things is huge. All those wearable health trackers, smart devices in our homes, they're generating tons of data, and that data can be incredibly valuable for managing chronic conditions, tracking the spread of diseases.
It's like having a 247 health monitor, but it's built into your everyday life. It's amazing and a little creepy at the same time.
Definitely. And that creepiness factor, it's something this document doesn't shy away from. It talks about the importance of data, security, and privacy, especially as we're collecting more and more health information from all these connected devices.
So it's about finding that balance between innovation and responsibility. But if we can get that right, the possibilities are pretty incredible.
Absolutely. We could have a world where your doctor is alerted the instant something's off with your health, even before you realize it yourself.
Okay, now that's some next level stuff.
It is. And as we look even further into the future, there's another technology that's still emerging, but it has the potential to be a real game changer.
Yeah.
Blockchain.
Blockchain. That's usually associated with like Bitcoin and cryptocurrency and all that. What's it got to do with healthcare?
I know, right? It seems like it's everywhere these days. But this document does a great job of explaining it in a way that makes sense, even if you're not a tech whiz.
Okay, so break it down for me.
Basically, blockchain is this super secure way to record and verify transactions, like a digital ledger that's almost impossible to tamper with.
Okay, I'm following so far.
So imagine a world where all your health records are stored on a blockchain. Only your doctors, with your permission, could access them. No more worrying about data breaches or your information falling into the wrong hands.
That's huge, especially these days when it seems like every other week there's a new data breach.
Exactly. And it's not just about security. Blockchain could be used to track pharmaceuticals, making sure the drugs you're getting are the real deal, and even streamline insurance claims, which could save everyone a ton of time and money.
It sounds like blockchain could bring a whole new level of transparency and efficiency to healthcare, but it sounds like it's still early days for this technology. What are the challenges?
Well, for one thing, blockchain can be kind of slow and expensive to use,
Yeah.
especially when you're talking about the massive amount of data generated by healthcare. And then there's the whole regulatory thing. Governments are still figuring out how to deal with blockchain, which makes it tough for companies to invest in it.
It's like the wild west of technology out there, but super interesting to think about the possibilities.
Definitely. And this brings us back to something we've been talking about throughout this whole deep dive: adaptability.
Hmm.
The healthcare world is changing faster than ever, and the companies that are going to win are the ones that can roll with the punches and embrace new ideas.
So it's not just about being smart, it's about being flexible, right?
Primarily.
This has been an incredible conversation. We've covered a ton of ground, from personalized medicine to artificial intelligence to the wild world of blockchain. I'm sure our listeners are feeling a little overwhelmed right now, in a good way, of
I
course.
hope so. Healthcare is a complex and constantly evolving field, but that's what makes it so exciting.
Exactly. So as we wrap up, what are some of the key things you hope our listeners are taking away from this deep dive?
More than anything, I hope they come away with a sense of optimism about the future of healthcare. There's so much innovation happening right now, so many brilliant minds working on new solutions. It's truly an exciting time to be alive.
I'm with you there. What else?
I also hope they come away with a deeper understanding of the complexities of this sector. We've talked about the financial opportunities, but also the ethical considerations, the technological challenges, the importance of being adaptable. It's a lot to consider.
It's a lot to consider for all of us, not just businesses, right?
Absolutely. This is about patients, providers, policymakers. Everyone has a role to play in shaping the future of healthcare.
So it's about working together to create a healthcare system that works for everyone.
Exactly.
Well said. And on that note, we've reached the end of our deep dive. It's been a wild ride. But before we go, I want to leave our listeners with something to ponder. We've mainly focused on how existing companies are trying to find their place in this new world of healthcare. But this document, it got me thinking, what about completely new companies? Companies born in the age of this unified health ecosystem, whatever that may be. Companies that are built from the ground up with a focus on personalization, technology, and creating a more sustainable and equitable healthcare system. What kind of impact could they have? That's something worth thinking about. Thanks for joining us, and we'll see you next time.